Greetings, everyone. This is Be Healthy. This is Dr. Bob SUMAYIRE. We are at the Africa Health Tech Summit, and it's ending today on Thursday, 31st October. And you have seen that I've been covering everything, and have been showing you different things that are happening, different discussions that are being held here, and we have been hosting different guests, and we are very much privileged hosting one of the organizers and the founders of this summit,
yes.
Philbert Nsengimana. He has been the Minister of Youth and ICT in Rwanda from 2011 to 2017 before he joined the Africa CDC, where he is acting as the Chief Digital Advisor. You're most welcome, sir.
Thank you.
You are the founder of this, and I think the owner of the idea of this Africa Tech Summit. So what was the source of the idea, and what was the vision behind this Africa Health Tech Summit?
First of all, I would say I can't say I'm the owner of the idea, but I have to say that I was privileged to be in a position to play a leading role in birthing the idea, in midwifing the idea. As you are a doctor, you understand what I mean?
Yeah, I understand.
And really taking something that many people had in mind into reality, which is before we started on the journey of digitalization of Africa CDC, we had to make sure that we are doing something that is not our own vision, but something that is shared broadly with the community. So we engaged in consultation with our member states, with private sector, the academia, the young people, and we realized that there was a need to have a convening platform, because engaging one-on-one is one thing, going country by country is very good, but it's time consuming. So we realized that at least once a year there is an opportunity to bring everybody together to sort of check the pulse of how the digital health initiatives and efforts on the continent are doing, and what we could do better, what have we learned, what are the success stories, but also what are the challenges that we can put our efforts together and solve. So that's how the idea was born. It was very small in 2022. For those who were here, you remember we were a side event at the CPHI, the Conference on Public Health in Africa. Last year, we were still another sort of side event at the Mobile World Congress. But the third year, as you could see, we are now standing alone as a powerful platform that brings together the technology and the public health sectors to advance health security agenda on the continent.
Wow. I want to ask, why AI? Why are you putting much efforts in this?
If you've been following this telecommunication tech sector for the last, let's say, 15 years, you know that 10 years ago, the focus was on broadband, on connectivity. We felt that until a critical mass of people are connected to the internet, can send at least an SMS, a message, we couldn't really talk about digital health. So a lot of effort was made, and investments were made towards getting people connected, getting health facilities connected. It's not mission accomplished yet, because there are some unfinished business in that domain. But people realized that at some point, and I would say towards 2013, 2015, at the time Smart Africa was getting in place, that perhaps there was enough deployment of technology that we needed to start really focusing on how do we make use of what we have. I think His Excellency the President always emphasizes the message that there are things that are in our hand for us to do. There are things that we don't need anyone's help to do because we have them. How can we make use of what we have as we aspire to get what we don't have? So there was this whole shift in mindset across the continent, and it was born here, right here in this country, in Rwanda, to shift from connecting to innovating and then transforming, and that even became the motto of Smart Africa. So we also went through that. So we are now at a point where, since technology moves fast, the next big thing is artificial intelligence. The impact of AI is predicted to be even bigger than the impact of internet itself. Even if AI runs on internet, it feeds on the data that has been generated because there is internet, but the impact, the transformational impact, the disruptive impact
beyond
is actually predicted to be bigger than the internet. So why AI this year is because we believe it's something that still needs to be understood. There is a level of awareness. There is a level of basic literacy for AI that is necessary for us as a continent to start harnessing it for the benefits of health.
Yeah. When you're talking about health, you can't leave behind the healthcare providers.
Yes.
And how are you working that these healthcare providers, the doctors, the nurses, are also integrated, are also fitting in this system or in this technology? Because they are the people who are always in files, treating patients, and sometimes they tend to get a little time to get attention to the technology and the AI that you are saying. So what are efforts being put in?
So, as you know, Africa CDC is a public health institution.
Yes.
And vast majority, maybe 80 to 90% of our workforce at Africa CDC are medical doctors and public health experts. So all these ideas are informed by their inputs, their ideas, and their vision. So that's number one. But I want to also go in the direction of your question to perhaps suggest, I think what I'm hearing is they are not sufficiently involved.
Yes, yes.
And it's notoriously known that healthcare providers have resisted technology. So to the point where even the WHO, they have a framework for digitalizing health, which has infrastructure, policies, strategies, investments, technology. But recently there is a suggestion to add change management as a component of that, because they realize that it doesn't matter how much even good technology you bring, if the people are not on board, if they have not been involved in the design, in the creation process, giving them a finished product will not work. So that is where we are taking a step back and say, let's engage better with the community of practitioners, from those who are on the front lines to those who are in big hospitals, and then even at the policy level, to make sure that the tech solutions that are being deployed are something that is user-centric. It's about being user-centric. So there is a bit of road to do in that domain. I will be frank with you. We called on the doctors and the nurses and the clinicians to engage through something that is known as the Africa Digital Health Networks. We recognize that there are some of them, like you, like many others, are already leaders in the domain. But on the way out from the room to this place, a young doctor approached me and said, we need mentorship. We are curious. We understand technology is a formidable force, but we feel left a bit behind as practitioners. How can we get some mentorship so that we can also lead the way in the digital transformation? But if you go to any health center in Rwanda, any hospital, you will find that a lot of what is done today is already computerized. People have mobile phones, they have apps and so on and so forth. So I wouldn't say we are starting from scratch, but I would say that if we get more and more practitioners embracing technology, we'll be moving at a much faster pace.
Would you please allow me to ask the last question? If not the second to last, in Kinyarwanda. So nifuza kubaza uri umunyarwanda ndetse iki gihugu kirimo wakibayemo, iyi technology cyangwa se n'ubwenge bw'ubukorano turi kuvuga mu Rwanda buri gukoreshwa gute, bugeze ku kihe kigero muri secteur y'ubuzima, ndetse wenda munatubwire mwebweho mwifuriza u Rwanda kuba ruri mu myaka iri imbere cyane mu kijyanye na secteur y'ubuzima cyane kariho muri kwibanda.
Ngira ngo icyerekezo ubuyobozi bw'igihugu cyacu bwaragitanze, ibijyanye no guteza imbere ikoranabuhanga, guteza imbere igihugu, guteza imbere imibereho myiza y'abanyarwanda n'ubukungu hakoreshejwe ikoranabuhanga, ni icyerekezo tuyoboyemo na nyakubahwa Perezida wa Repubulika kimaze imyaka irenga, naho ngira ngo byanditse mu nyandiko imyaka irenga 25, kuko byari muri Vision 2020, uyu munsi biri muri 2050. Igihugu rero giteye imbere kandi gikoresha ikoranabuhanga mu nzego zose kugira ngo twihutishe ubukungu, twihutishe guhindura imibereho cyangwa se gutuma imibereho y'Abanyarwanda irushaho kuba myiza ku buryo bwihuse. Hari n'imibare n'ibyitegererezo byagiye bitangwa, navuga intego zashyizweho z'umubare w'Abanyarwanda bazaba bafite ikoranabuhanga riteye imbere. Ku bijyanye n'ubwenge bw'ubukorano, hari politiki ngira ngo imaze iminsi ishyizwe ahagaragara, ndumva ntajya muri detail kuko hari abayikoze baranayisobanura, ariko ikigaragara ni uko izanye amahirwe adasanzwe. Noneho ku bijyanye n'ubuzima, izanye amahirwe yo kuba twayikoresha kugira ngo turengere ubuzima bw'Abanyarwanda n'Abanyafurika, ariko nanone tubikore mu buryo bubyara n'inyungu, kuko birimo ubucuruzi, birimo guhanga ibishya, urubyiruko rurabyitabira cyane. Tureba byombi, tureba kurinda ubuzima, kurinda kuzamura imibereho myiza, ariko tukanareba byafasha iki kuri babandi babikora ku ruganda, navuga uruganda cyangwa se industry, ku ruganda rukora ibyo by'ubwenge bw'ubucurano bw'ubukorano, kugira ngo nabo bushobore kubateza imbere. Aha rero ngira ngo ikindi na politiki igaragaza ni uko harimo na risk cyangwa se ingaruka abantu bagomba kumenya no kwirinda izo ngaruka. Ibyo byose n'icyagomba gukorwa byose bikubiye muri uwo murongo watanzwe. Ngira ngo umuntu icyo yakora no gushishikariza abantu kumenya, kubisoma no kubikora, kubishyira mu bikorwa, cyane cyane urubyiruko, kubyaza umusaruro amahirwe yatanzwe, no kuba nanone bijyanye na cya cyerezo cy'igihugu cyacu cyo kugira ngo u Rwanda rube rwaba icyitegererezo, kugira ngo isoko rigezwaho ubwo bwenge bw'ubukorano bukora hano mu gihugu cyacu bushobora no kuba bwagera ahandi, n'ababikoramo ubucuruzi nabo bashobora kuba babibyaza umusaruro.
Yego,
murakoze.
Reka tugushimire cyane ku mwanya mwiza mwaduhaye.
Yego,
imirimo myiza.
sawa, murakoze.
Yego.